Hi everyone, it's Sean from STK Markets here this year for the start of the new year. Just had Australia Day yesterday. We're catching up with Aegros. We had a very exciting year, breakout year for the company. It was one of our investments, as you all know, and one of yours that went extremely well. It's been a little while since we've touched base with them because of Christmas and New Year's. So we thought to get them in the office today. We've got 3 burning questions that we'll fire off straight away and come back to those later. But we sort of want to get a retake of what actually the company has achieved in the last 18 months since we've been really closely watching them. We've been following them for quite a few more years than that. But in the last 18 months, it certainly was the breakout pivotal moment for the company moving forward. But John and Hari, welcome today and thanks for joining us.
Happy New Year.
Yeah, Happy New Year. Absolutely. And this is going to be as you said, awesome year for Aegros.
Well, I think I completely agree. I've exercised the other day 100,000, $2.30 options, and I'll be certainly exercising more over the next 2 months as that March 30 deadline looms. But we're certainly very excited putting our money where our mouth is, as we generally do. But we've got 3 questions, which I think everyone wants to know very quickly. How's the trial going? Is it going well? The strategic partner with Macquarie, how's that progressing? And is the IPO still on track? I mean, they're the 3 burning questions I get daily. If you just want to address those, guys, and then we can get a bit of a recap of how we've gone.
Okay, let's start with the clinical trial. As we mentioned last year, end of last year, we have infused our Covimmune product into 1 patient. We have had startlingly absolutely no side effects, adverse effects as far as the patient is concerned. Sometimes you find that people may have headaches or pains or something of that sort. Absolutely nothing. The actual results are obviously quarantined and we can't talk about it until they're officially released. Having said that, the Kirby Institute working with us obviously have had a look at what is known as the neutralizing antibody levels in the actual medication or Covimmune that we infused. And that's sky high. I mean, they literally have to devise another test to have a look at what the concentration is. So
off the scale.
Off the scale. It's about 10 times higher than what we were expecting. So I am expecting, knowing the physiology of human beings, that you'll be getting a big spike. Now, the Christmas break has put a little bit of a hold on the trial, primarily because people have gone on holidays. Medical and nursing staff have not been available, etc. We've just finalized or finished a manufacturing run, and we should get the 2nd and 3rd patients in the Sentinel group done in the middle of February. So all's well for that trial, and I'm looking forward to completing the other 2 patients in that first group.
In terms of the strategic investor, that is progressing very well. We now have engagement from a number of different parties. I won't go into any names, obviously, at this stage. I do think it's going to take until probably April or May. And the reason is that we are going to go slowly so that we get the maximum value. And the maximum value will come once we have completed the clinical trial and we are either about to start sales or we have contracts. So at that stage, it becomes a much greater bidding war. And I'm sure all of our shareholders want us to maximize the value that we can possibly generate from this. The final question was, is the IPO on track? Absolutely. We are talking about the IPO, I would say, Q4 this year. The drivers for that will be twofold. It'll be whatever comes from our strategic investor, if that impacts on that. And secondly, it'll be once we start our first sales. So I think those 2 things, obviously, plus the conditions of the market at the time. But subject to that, I don't see any reason why it won't be the end of this year.
I mean, I think just to add to that, we are structuring it so that we can get ready for the IPO. So, people have been employed. Alex Stuck is now responsible for organizing the IPO group. And that, needless to say, we are looking at a multi-billion-dollar listing. And if you're looking at a multi-billion-dollar listing, you've got to prepare for it. And this is exactly where we are.
That's fantastic. I mean, we're looking at a 600 million valuation at these prices, multi-billion. You're looking significantly higher than here, which is great. Now, That's all very well and good. The trial's underway, everything's going well. The IPO's on track, strategic partner, all there. It's all progressing beautifully. We just want to get a quick idea. The last 18 months have been standout. I mean, you got TGA approval for the facility. We safely completed the first arm of the first trial. Kirby Institute validation for Covimmune. Successfully raised 50 million with the valuation going up each time because you keep hitting milestones. Macquarie Bank to do the strategic partner. I mean, where does it stop? You guys just kept achieving. You must be very pleased.
It doesn't stop, and I think that's the point.
It accelerates.
It's exactly right. What John and I have been able to do, and it's something that we say to our colleagues here, employees here in the company every day, is when you promise something, you've got to be able to deliver. So our efforts have been based on establishing Australia's other plasma fractionator, and every goal that we've hit has basically established that, validated that, and that's where we're going to end up. We are Australia's other plasma fractionator.
Yeah, and I think, look, let's just hit a couple of points that we achieved through the year because it's important. So we set ourselves a couple of clinical trials for the 2020 year. The first of those was to commence the clinical trial. The second was to get some form of government funding for a 1 million litre facility, which was never considered in the 21 year. It was just beyond our wildest dreams. And to set ourselves up for an IPO in the 23 year. Now, we achieved both of those goals and we got there ahead of schedule. And we've reported, as you know, that we did our first dosing in December. And we reported also that in December, we got the Queensland government to support us with the 1 million litre facility that they will be helping us with up there in Queensland. The other thing which has become very apparent across this 12-month period is just the number of people you need to make a business like this work. We've now gone it to 110 people. We're in the midst of a review by the TGA. When I say review, they just come through yearly to make sure that our license is appropriate, and obviously that's going well. So we've had the TGA come in and do their review, and we're now set up to complete the clinical trial early in the new year. The most important thing, though, is as soon as we did that first dosing, it took away all of the risk associated with a new technology. We now know this technology works. The other thing, because of the growth and the growth we're going through, we've decided to reorganize the business so we're set for the IPO. So we're going to reorganize the business around the P&L businesses, which means 3 businesses. We'll have the therapeutics business, which is the one that makes the Covimmune and the therapeutic products like that. The second one is the engineering division, which will set up the new facilities, including Queensland, and then the ones overseas that we've been talking about. And the final one will be the consumables division, which is the division which will make the membranes, the secret sauce, if you like, and they're the things that will then be shipped overseas as part of our sales and establishment of these new businesses overseas.
Yeah. And we've been able to attract some very unique talent in order to do this. And the more people that we bring in with that talent, the better the company becomes because of that. So I think, we are poised to be, again, a very relevant player in the world of plasma fractionation. And that is part and parcel of the energy that we have put together, the focus that we have to make things happen.
That's fantastic, guys. It just keeps getting better and better. Hari, well, you're just talking for the moment. When you said those antibodies went through the roof, that the Kirby was very happy. Again, it's not just Aegros saying these things, or you as the professor say it. We keep getting these third-party validations. The Covimmune's great. I mean, we've got safety, we've got effectiveness, it looks like. The trial's going extremely well. It's just we have to adhere to the TGA rules and regulations, and it looks like we're just going to get there. As you said, it's proven everything works. It's just a matter of time.
It is, and you never rush things like this. There's a whole element, as you said, Sean, of patient safety, and that's paramount. As far as this company is concerned, we will never compromise that. But the third-party validation is part and parcel of what we do. And that is primarily because it's not good enough for us to be saying something and not validated by people outside the company, experts outside the company. So the other element of all this is that even this morning we were talking to international researchers, and I hope to be able to talk to you about who these people are. They're from some very eminent universities in the United States, and they are totally excited about the ability to use Covimmune in the treatment, and I'm talking about treatment, right? Treatment of COVID in immunosuppressed patients. So there's excitement that this whole project, this whole company has engendered internationally. And that is something I think we should all, investors, executives in the company, employees in the company, we should all be very proud of. We're making something special.
Yeah, actually, it's amazing. Ever since that first dosing, that announcement of the first dosing, and the information is obviously filtering out into the world. And the number of interested parties is just phenomenal. And it's only going to grow. And this is because there is no alternative. The monoclonals, as this group was telling us this morning, I don't think any of the monoclonals, not even Evershield, work now.
So Trovimab is one that has got some effect, but it's not very clear. So literally, people are looking for an alternative, and the alternative is here.
I can also say you're making waves for helping with the capital management of the company with the raisings. I mean, I spoke with you a few days ago. We've got a meeting next week with one fund that manages $5 billion, and they've contacted us. They're not the only ones who are in contact with us wanting to do things as well. We can tell that you're getting out there. I think you are becoming more and more of a threat to CSL. And I think investors are looking, the larger investors that have big positions in CSL are seeing Aegros a real threat and potentially having Aegros shares in their portfolio as that hedge to CSL.
I mean, I hear that, and, you're a threat to CSL and you're dangerous to CSL, all these sorts of phrases. I have to say, we are not focused on CSL. I mean, they're a great company. We've got nothing but good things to say about them. But, the future is in our area. And that's the only thing that we are focused on. And we know that literally once 2025 comes around and the new facility is up there in Queensland, it's going to be light and day. I don't think we need to worry about CSL. I think we focus on what we're doing and move forward.
Yeah, there are two elements to this, right? There was pre-COVID and post-COVID.
Yeah.
Pre-COVID, there was no necessity to look at backups and being self-sufficient and self-reliant and all that sort of thing. Post-COVID, that's what it's all about. And that's what Aegros is about as well. Aegros is a company in its own right, but Aegros can literally provide what Australia needs right now, and that is the ability to become self-sufficient in plasma-derived medicines. And that is what our focus is, and literally that's what the whole company is working on, and we will make it happen.
Yeah. And delivery is one of our core goals. And last year we gave you 2 goals, milestones. This year we'll give you 2 more. It'll be complete the clinical trial and get sales of Covimmune. Obviously, they are the operational ones. They're the only ones we're focused on. The others, the financial ones, will happen in the background. And I have no doubt that we'll get that strategic investor across the line somewhere, certainly this side of June. And then secondly, we will list at the end of the year, or worst case, following year, beginning of the following year, depending on the factors that I mentioned before. So 2 things we're focused on, and the rest will just flow.
That's it.
That's very exciting. You've got the, hopefully we'll see in the next month or so, those 2 new patients get injected. That's a great uptick there. And that brings me to another thing. Evaluation has been going up. We're looking at, you had an valuation from average, and it's already around the 400 million mark from memory. Have you got that valuation upgrade back yet? Or?
We'll have that very soon. I think, though, it will be multiples of the old valuation, but I think that's something that we will probably disclose as we go out with our notice of meeting, because we got our accounts completed for the 2022 year. There'll be a notice of meeting going out, so there'll be a shareholders meeting in early March. We're also, because we're aware we've got the $2.30 share options which expire on the 31st of March this year, we will also have an open day somewhere in the middle of March as well, and more information on that later, so that investors and shareholders can come in and kick the tires. At that stage, we may well be in a rebuild of that facility. So we'll have to wait and see what people can see, what they can't see. But we would encourage you, if you have any questions, come in, ask us, and if we can't answer them, then you shouldn't be investing. As I keep saying, this is a tough area. And there's one thing that we do have, and that's the experience. We have the team that goes with that, and that's what makes the difference.
Yeah. In the next couple of months, we are going to be renovating the facility in Sydney. It'll go up to being able to process about 150,000 liters of plasma with the state-of-the-art equipment. And it really is a sight for sore eyes, let me tell you, when you look at what we're going to be ending up with. And this is even before we start off with Queensland. So again, I think that shareholders or investors who want to come in and have a look will be suitably satisfied with what they see.
Absolutely.
And Queensland's looking like that's on track. Everything's progressing up for the 1 million litre facility.
Yeah, it certainly is. We are well into design phase at the moment. We've made applications to the Ipswich Council for approval for the build. We've been busy. We've been extremely busy.
Yeah. I mean, it's a $500 million project. This is no small undertaking.
Well, it's exciting. Well, guys, we've got a very exciting year in front of us. We've got that new valuation coming up, more updates on the trial in the next couple of weeks. You've got those options. Thank you for inviting investors to come see the facility. Those options expiring the 30th of June will be very important. If people want to exercise those because the company is performing so well. Yeah, this year's going to be a breakout year. Those two milestones you've got there, clinical trial completion and then revenue, then obviously that comes listing. It's very simple. So yeah, looking great, guys. Thank you so much for your time.
Thank you. And we look forward to seeing everyone.
We do.
Hello, my name is Dr. Hari Nair. I am the Executive Chair of Aegros and co-founder of the company. I am a hematologist by training and I have a PhD in medicine and clinical science. Aegros is Australia's second plasma fractionator, and the technology we use, the HemoFrac, is what is going to turn the plasma fractionation industry on its head. Current plasma fractionation uses what is known as the Cohn-Oakley-Kleister-Nishman system, which is composed of a multitude of steps which take into account things like your pH, ionic strength, temperature, etc. The multitude of steps, which is very important, create a situation where you can actually exaggerate losses so that the final product, in the case of immunoglobulin, only 50% is produced. And this is significant when we are talking about the use of these particular plasma products in industry. The HemoFrac system is a 4-step system and is composed of one capture step. What it does is that it gives you very high yields, and this, we believe, will take care of the shortage of immunoglobulins in our health system and most possibly in a global sense. Aegros' HemoFrac system is an electrical environment system consisting of 3 membranes, one on the top, one in the middle, and one at the bottom. Protein molecules are then charged using a buffer, and in this particular instance, the positive immunoglobulin molecules are then transferred across the middle membrane into the lower stream towards the negative electrode. The HemoFrac system is a 4-step process compared to the multitude of steps that's required for conventional cone. Now, in spite of that, what you get is a very high yield, very high purity, and low running costs with minimal impact on the environment. Hello, I'm Professor Hari Nair, co-founder of Aegros, here to introduce the Australian-invented HEMOFRAC. Housed in our state-of-the-art 4,000 square meter plant in Sydney, we use the HEMOFRAC to make Covimmune, a hyperimmune against COVID-19. Research and development is key to our success, creating a revolutionary 4-step process with yields of 90% and product purity of 99%. Membrane technology is the heart of HEMOFRAC, and we make our own right here on site. The HEMOFRAC lives in our TGA GMP approved clean rooms, making hyperimmunes from blood plasma. And we have our own extensive warehouse capacity. Aegros is replicating our HEMOFRAC all over the world as we aim to provide self-sufficiency in blood plasma medicines, in line with the WHO mandate. We are Aegros, patients first through innovation.